Okay, so we want to just get a quick, just to make sure everything's okay with our sinuses. So you just want to just do just a brief, just a touch. Okay. Now, what can swell during pregnancy?
Your hand.
Yeah, we're not expecting that.
When you have preeclampsia, what can smell? What can swell?
Face and your hands.
Your face and hands, but if your face is swollen, what else is swollen?
Hands, brain. Oops.
So we need to do just a very quick CNS scan. Not all the cranial nerves, but we're just going to do ELMs. So Danny, watch my finger. Now listen, you guys, it's only 12 inches, this box, and you pause in the corners, and you're looking for what? Nystagmus. And that's squiggly eyeballs, and that tells you what?
The brain's not.
Yes, it tells you have CNS irritation, right? Now, we're just going to do a quick purl to make sure we're okay.
It's 2 L's, right?
Purl, yeah. Pupils equal,
Round.
reactive to light, and
No, it's-
accommodation.
It's 2 R's, 1 L.
Yeah. Okay, so I'm gonna have Danny look over my shoulder, and I'm gonna do it 2 times. I'm gonna look in this eye, and I'm gonna do, what's that one called? Direct. So what am I watching for?
Pupil
Pupillary
constriction.
And now I'm gonna also shine it again in this side, but I'm looking at this one, and that's called consensual. So I'm gonna do direct and consensual, okay? I'm gonna do direct and consensual. Okay, now I've got to get my accommodation, and what is accommodation, you guys? Yes, when you look at something close, your pupils constrict to have less light, right? Let less light in so that you can focus on it. So I'm gonna say, Danny, look out that window as far as you can, and now Danny, look at my finger. And I saw a constriction, so there's your accommodation, okay? So we're good. Now, I'm just gonna take a quick look at Danny's mouth. Why would I look in Danny's mouth, you guys?
So, like, oral hygiene.
Oral hygiene. If you're not having calcium, then we might have some caries. Also, we might have swollen gingiva. We might need to do some teaching, because isn't that normal for your gingiva to swell? So I'm gonna look in Danny's mouth. What else can be in Danny's mouth? Not in our Danny's mouth, but Danny in the clinic.
Remember that big fluid you can't swallow? What is that?
Yeah, tylism. What else? Herpes. What else? Syphilis. HPV lesions. Okay. So, so we're gonna look in Danny's mouth and just say ah. Okay, good, Danny. Awesome. Okay, now the next thing I'm gonna do is if Danny had contracted syphilis or something in her mouth, or had you can have gonorrhea in your mouth too, but if you have any of that, what do your blood filters do? They swell them. Yeah, you get lymphadenopathy, where your lymph nodes catch the bacteria so it doesn't spread throughout your body. So you guys, since this is women's health, and people do have exposures to bacteria through their mouth, thank you, Becca. She's videotaping.
I'm keeping you clean.
Then we want to check for lymphadenopathy, okay? So I'm just going to do preauricular, postauricular, occipital, submandibular, submental, posterior cervical, anterior cervical, posterior cervical, anterior cervical, tonsillar, supraclavicular, and deep cervical. Go with that. Okay, and I feel nothing, so that's awesome, right? Sounds good. Okay, so look at Danny's face. It's not swollen. Am I happy? Yes. What if her face looks darker than her neck and her arms?
Darker.
It's okay. It's okay. What is that called? Chloasma. So it's all right. You're going to be fine with that. Now, so everything looks good. So the next thing I'm going to assess on Danny is I can listen to her heart, and just so that you guys remember, what is that called? The angle of Louis. And that articulates with the second intercostal space. So what you want to do is you want to run down and find the angle. If you start shooting in the dark, you're not going to be in the right places to hear the valves, okay? You're not in the right places. So you've got to find the angle of Louis. You're going to go over, and it's in that first hole. So find the angle of Louis, and then right below it, it's going to articulate with that second intercostal and go right there. So what spot is that? What are we listening for here? Aortic. The aortic, right?
Mm-hmm.
Listening to the aorta. Okay, who's
Yep.
the cross the street neighbor? Pulmonic.
Pulmonic.
Oh, yeah.
Okay, pulmonic. Then, what's really nice, you guys, you can use your stethoscope head. If you just go one down, that's herbs. Another down, tricuspid. Isn't that nice? So you got aortic, pulmonic, herbs, tricuspid, and then fifth midclavicular, ICS, is
Or
mitral. Now, what is normal in pregnancy? How much fluid do you gain?
1500.
1,500. So what kind of murmur might you hear? Systolic. Is that okay?
Yeah.
Yes.
It's okay. All right, so you're going to do with your diaphragm, and then you're going to do with your bell. Okay, so here's the angle of Louis. We're going to go over, and then we're going to go in that first hole. Okay, everybody feel yourself. Not touch yourself, feel yourself. Okay, so here's my angle. And go over to the right, and then in that first little hole. Can't you feel it? It kind of hurts when you poke in that hole a little bit. Okay, that's your second intercostal space. So you want to go aortic, pulmonic, herbs, tricuspid, and mitral. Okay? Is that essential that you listen?
Yes.
Yeah, absolutely. Because what happens with all that fluid if you have any undiagnosed cardiomyopathy? It's going to get worse. Yeah, it's going to get worse. Okay. So we're going to skip that part on Danny. But I do want to show y'all this. When I go to Danny's mitral valve, so let me just show you. So here's our angle of Louis. I come over here. And this is where I start, okay? But so I go aortic, pulmonic, herbs, tricuspid. Now when I need to get to Danny's mitral valve, there's a certain way that you do it in women's services. Danny, lift your left arm up, straight up. Then you take the back of your hand and you lift the breast, okay? And then there's mitral. You never go like that. Okay? Okay? You always take the back of your hand, you say, I'm sorry, and then you just lift up like that, okay? Now, for lung sounds, the one thing I didn't forget to tell y'all is make sure that you look at her thyroid, how her lean back. Because remember, doesn't your thyroid enlarge during pregnancy? Up to 30%. But dudes, if you see one that's like this, we know we got issues. So have her just lean her head back, look at her straight again, make sure it's in line, and then look at the thyroid. It's on your piece of paper. If you guys look at this piece of paper, you guys, this is a postpartum assessment, because I couldn't find the antepartum assessment, but most of it is all on, okay? So now when I'm listening to Danny's lungs, I'm just going to listen here, here. I'm going to listen 4 places, at least on the front. I'm going to listen to laterals. Danny, put your arms up. So how many do you have on your right? 3. You compare an apple to an apple. You compare an orange to an orange. And then here's a banana. Remember, you got 3 lobes? Okay? So you always compare right to left, left to right. Remember, 3 on the right, 2 on the left. Okay? Now this is general assessment. I'm not going to do the belly. I'm just going to do like kind of head to toe real quick first. So if I needed to listen to bowel sounds on Danny postpartum, of course, if I heard bowel sounds in one quadrant, that would be sufficient. Okay. I do want to look at her back. Any patient that you're examining, you need to look at their back because what are you looking for back here?
Abuse.
Absolutely, Paul. And any inflammation. Also, you guys, how about Danny as a drop-in? And Danny drops into my hospital and she's laboring and she wants an epidural. What if I see a big curvature in her spine? She's going to have scoliosis. Are you going to call anesthesia and say, I need you to come stat and do a epidural? No. You got to look for that spinal column. So I'm going to look back here, make sure she's nice and straight, which she is. Also, you guys, I've got to listen for, I've got to do my lung assessment in the back. And remember, when we do our lung assessment, how do we do it? We go here. You're not going to go over the scapula. Can you hear anything over the scapula? No. So you go here, 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 and then at the bases, here and here, okay? Now, the next thing I need to do, remember, what happens with the bladder when you're pregnant?
Speed up.
Your bladder?
Get beat up.
Yeah, it gets beat up, but when you're pregnant, remember you can have urinary stasis and you can have a silent UTI. If the silent UTI is not discovered and treated, what does the bacteria do?
Inflame.
It ascends up to the kidney. So you've got to check for CDAT, so costiovertebral angular tenderness. So I'm going to just give Danny's kidney a little, does that hurt, Danny? And then how about right here? No. Okay? So you need to check those things. And this is on a patient postpartum, antepartum, whatever. Now, if they had had an epidural, of course, we want to look at the epidural site. And what are we going to say? Do you have a headache? You just want to go ahead and ask the question while you're there. All right. Now, we'll have Danny lay down. I would do a, go ahead and do that, Danny. We're going to pretend like Danny is, can you pause it?
Yeah.
Okay.